My name is David Grant. I'm the Chief Operating Officer at Keystone Health in Franklin County, Pennsylvania. We're a large federally qualified healthcare center. And I'm here today sharing the space with Pam Laye. Pam is our outreach enrollment manager, and she has been knee-deep in the Medicaid unwinding. And we thought we'd share some of our experiences with you today for some innovations that can help assist with this. There's some history and some updates just recently published on our DHS website. The latest data shows that approximately 230,000 Pennsylvania beneficiaries were due for a renewal during the month of June. Of those beneficiaries, 86,600 renewed and retained Medicaid or CHIP coverage. About 10%, or 23,500, were found ineligible and were transferred to Penny. Just under half, or 101,800, did not complete a renewal. This leaves approximately 17,125 being terminated for procedural reasons such as failure to respond. So obviously a very pressing issue in Pennsylvania and certainly in our community here in Franklin County. I want to turn it over to Pam, as Pam has just really been at the front lines of this. Pam, what are you seeing as the primary problem you're facing today with the unwind?
So because of the unwind, no one had to re-enroll, renew for that 2 years during COVID. So in that time period, some people could have moved, their information is not up to date. And then we're down 100 workers case-wide.
100 workers case-wide.
For the state.
For the state.
So you've got all these renewals coming in, you're lacking workers, incomes have changed, people moving in and out of the house, stuff like that.
Tell me about the processing at the local level. What are we finding?
They have 30 days technically to complete an application. Some of the applications are not being completed until day 30. So if they're now over the income for Medicaid and it's moving them to CHIP, that application is now going to CHIP, which takes time to process. So now we have a lapse in coverage. So state insurance could end here and CHIP could be 4 weeks, 6 weeks down the road. So you've got children that are uninsured for that time. We've got people that are also losing state benefits and the applications are being forwarded to Penny.
In particular, can you share with me, obviously de-identified, any specific examples of lapses that you're seeing or what you've been dealing with lately with some of our patient populations?
There's 8 of us altogether, but we have 4 cases in particular that the renewals were done timely. So end of April was a couple of them. Their insurance was good until the end of June. 1 sibling was approved, 1 sibling's kind of like out in limbo. So when we've contacted the insurer that the other child has, we've contacted the state customer service center, and they're just telling us it's being worked. It's stuck in the system, to say, is what they were saying. Other ones, like one I just checked today, they're renewed, was finally approved, but it starts August 1st.
Okay.
Their state benefits end at the end of June. So we have a month lapse there. So I'm not sure, we're working on that to see what route we're going to go, because that child did have services. So these kids are not covered, so they're canceling doctor's appointments. They could be going without meds. I mean, there's just...
This is the impact to our population, as we're seeing. Even a month lapse in coverage, they're receiving services, so they're accumulating debt, I assume, during that period of time. With the lapse, they're canceling appointments. Right. So, they're
I have one mom in particular that keeps calling me. She's actually set up a payment plan with our billing department because the child was seen early on.
Okay.
Still no coverage.
Okay.
And we're checking it daily, but still no coverage.
Are you finding this in adults as well? Are we seeing
no, not so much, because with an adult, if they've lost the coverage, they're automatically going to get a penny. So, and we're telling them that. We're getting those phone calls also. So what happens with that is, as soon as we know that, we can go in and create the application with Penny.
Okay.
And then we can ask for retro coverage as long as they want to pay that premium. Right. So they wouldn't have a percent. And we've had people.
As far as the process locally, just walk me through, what is the renewal process at this point?
The client would get up to 3 notices. So that first they get a letter that says your renewal's coming, make sure you follow through.
Okay.
Then you get a postcard. Even once they get that postcard, if it has their record number on it, then we can go in the system and do it. Okay. But we need to have their record number. And then lastly, they'll get the renewal packet.
Okay.
So with the packet, if possible, we can do it online, which is nice because it pulls all their information in. We just update it. If they've changed jobs, we change that, we change the income, but it populates everything. So it's streamlined.
Pretty streamlined. Okay.
But if they're, undocumented.
Here comes the
we
but.
have to do paper, which it takes longer.
Okay.
But the number one reason a lot of times it's denied is supporting documents, so they don't have everything.
Okay.
And it trickles in. It slows it down.
Slows down the process,
Yeah.
right? And as I understand, in Pennsylvania, that application has to go to the county level first.
Yes.
And I understand that's a lot of the bottleneck at this point, is that those caseworkers you were speaking of, they're at our county levels, there's not enough caseworkers to handle this caseload. And therefore, there's backups and otherwise. Correct me, but I've even heard situations where just out of desperation, patients are directed to our local emergency departments.
Yes.
And then of course, as a former emergency department administrator, that's the last thing we want.
That was one of the suggestions. Just tell them, and that came from one of the county caseworkers. Is go to the ER, build a bill. We'll cover it. Well, what if you don't cover it? Now you're adding stress to that patient that already is uninsured.
Right.
Because you could end up with a couple $1,000 bill at an ER.
Oh,
Easy.
absolutely. Yes.
So that's not the solution.
Not the solution. What is the solution, I guess, now that we've described this sort of dismal process at this stage.
I know we need to hire more workers,
Right.
but that takes training, that takes time. You've got to they got to know what they're doing once they're in there.
And from what I learned from you, this is not a simple process.
No, it's not.
Very complex.
Because there's different categories that you qualify for, and the income's a piece, family dynamics is a huge piece,
right?
And it's a process.
Okay, so we need more workers.
We need more workers.
How about the notification? I understand that part of the process is that patients have to be notified as well that they have to renew. Have you found that some are caught off guard and maybe just didn't receive the cards?
I do know that for a fact that some of them don't get the mailing. Why? I don't know.
Right.
But anybody that comes to us on a regular basis, they're calling, they're aware, they're paying attention. And we tell them as soon as you get that packet, come in, because the sooner you get it done, the likelihood of you having a lapse is less. So, gather your information, and that's another big piece. Make sure you bring what you need.
Right.
All your supporting documents, we need that. We have to supply.
That first, step one.
Yes.
Okay, great. So I know that PAC, which is the Pennsylvania Association of Community Health Centers, they've partnered with PHA and a company called Gavin, which is a nationally ranked branding firm. And utilizing current health center marketing and campaign strategies, they created these customizable Medicaid unwinding templates for use at community health centers. Have we yet taken advantage of that, or have we felt the need to do that yet?
We did when the unwind was going to happen. We had the Facebook blast,
Okay.
We had social media, we had signs up at the offices and stuff that the unwind was coming, and make sure you get your renewals done. So we did jump on board with that.
So marketing, and the templates I'm speaking of, they feature images, posters, social media posts, graphics, digital ads, animated ads, and lobby monitoring signs. And package training as well. So really at the end, I think it's about notifying patients that they're going to be due for renewal, getting the word out there, trying to get them in before this 30-day window seems to be a big deal.
Yeah.
And if they can get processed quickly.
We do have 6 outreach events coming up here within the next 2 weeks.
We do.
And so one of the navigators will be at one of those events.
Okay.
So we have them all covered. And we do that. We tell them, if you get anything, get it in. This is where we're at. And just to try to help.
Okay. We're doing that throughout the county.
Mm-hmm.
Okay.
Yeah, what leads for all.
All right. Excellent. So great. Well, hopefully during this short session, we were able to provide you at least some insight into what we're seeing on the ground in one county in Pennsylvania. I'm sure this story's playing out in many areas of the country. Again, we hope you found some insight here. And Pam, I wanted to thank you. I know your time is valuable. I'm certain that you're going to head back over and continue to enroll. So we appreciate all your efforts. And thank you, everyone. We wish you a good day. Thank you.
Looking for more answers in population health? Be sure to attend PHA's Innovation Summit October 25th and 26th at Top of the Hill in Washington, D.C. Learn more and register today at populationhealthalliance.org.